The views and opinions expressed on My Story Living with Lupus podcast represents each person's individual experience. By listening to this podcast or reading our blog, you agree not to use this podcast or blog as medical advice to treat any medical condition in either yourself or others. As always, consult your own physician for any medical issues that you may be having. My Story Living with Lupus podcast is officially trademarked, all rights reserved. Thank you for joining me for another episode of My Story Living with Lupus podcast. I'm your host, Susan Hendricks, and I'm so glad that you could join me on this Saturday, November 28th, 2020. Hey, I know I'm late, but my lupus has been acting up and I'm experiencing fatigue. So charge it to my head and not my heart. Today's episode is all about health equity along with health disparities in lupus. So you know what I want you to do. That's right. Go grab your cup of coffee, your cup of tea. And to my listeners late at night, you know I appreciate you. So grab your favorite glass of wine and get ready to join the conversation right here on My Story Living with Lupus podcast. Thank you for joining me. You know, before I get started, I would just like to welcome all of the listeners on Pandora. That's right, My Story Living with Lupus was picked up by Pandora Podcasts. And to my new listeners on Pandora, what this podcast is about, it's about chronic illnesses. Yes, I have lupus, but I don't let lupus control my life. On this podcast, you will get factual-based research information on lupus. You will take away what questions you need to ask your rheumatologist. You will find this podcast very informative. I will tell you things that your doctor may not tell you, but it is also good to have an open dialogue with your physician, regardless if you have lupus or not. Have an open dialogue because doctors are not psychics. They can't read your mind. They need to know your actual and factual feelings. And if you don't particularly care for a doctor, there is no harm in finding a new one. You will notice and hear from other people that I have interviewed on this podcast that we all have ran through a gamut of physicians, from those who will tell you it's all in your mind to those who take that Hippocratic oath seriously. You will find an abundance of information here in the previous podcasts that have been recorded. So, welcome aboard. You have your cup of tea, your cup of coffee, or depending on when you're listening, your glass of wines. And also, before I forget to my new listeners, I will take you through my ups and my downs of dealing with this illness. I've been dealing with it since the age of 5. I have had 2 heart procedures and 1 heart attack. So, welcome aboard. Don't be scared to ask, to email me any questions that you may have or a particular subject that you want me to research on. That's what I am here to do. Today we're talking about health equity and disparities when it comes to lupus. Now, first we have to understand what is the definition of health equity. Well, health equity can be defined as this. Health equity refers to the study and causes of differences in the quality of health and healthcare across different populations. Health equity is also the pursuit of an equal opportunity for all people to achieve their best possible health. This means deploying solutions that are capable of meeting the magnitude of the barriers or problems that impede the realization of optimal health, especially for marginalized groups. That's what health equity is. Study and causes of differences in the quality of health and health care. I'm drinking some tangerine tea, and it is so good. But I want to tell you about a situation that usually occurs when I go in to see a new physician. When the doctor came in and started going over my medical history along with my medications, and I started telling the doctor what each medication was for. And the doctor stopped doing what he was doing and looked at me and stated, now this is a perception, and stated, "You're smart." And I said, "Why is that?" We have patients that don't even know the medications they're on and what they're for. I said, so why does that make me smart and not health conscious? Because I'm my own best advocate. And I told the doctor, I said, maybe your patients haven't been educated on how to know what medications they are on and what they're for. But instead, most doctors just write a script out and say, okay, I'm going to give you this hydrochlorothiazide. Take it 1 tablet every morning. But did you tell the patient what it was for? Did you tell the patient the side effects of that medication, if any? Instead, some doctors, I told him, just send patients merrily on their way with a script in hand instead of educating the patient. And so he looked at me and he said, "You're educated." I said, "We all are educated." And so he proceeded to ask me about the surgeries I have had. And so I started rambling them off along with the date, but I was using medical terminology. And he looked at me, he said, "How long have you been in the medical field?" I told you were educated. And I told him that has nothing to do with anything. And I'm telling you this to say there are grave misconceptions within the community that certain groups of individuals don't know and don't care about their health. And it is up to us as being health care patients, which makes us healthcare consumers, to educate ourselves on every aspect and at every level. When you walk into a physician's office and you're seeing them for the first time, you should have in tow with you, if you can't remember it right off the bat, a list of all your medical conditions, your medical history, your operations, your list of all meds, and a list of your allergies. You should have that with you when seeing a physician because, like I state, there is a misconception out here that we don't care about our health or that it is all in our heads. And that's where health equity comes in. It is an equal opportunity for all people to achieve their best possible health. And the way you do that is number one, become educated about your body and your health. Number two, talk openly with your physicians because they are not mind readers. Don't feel intimidated by that white lab coat or the scrubs that the doctor may have on. remember they are human also. And number 3, speak up and speak out because you are your own best advocate. Now we're going to talk about disparities. And disparities in lupus care and outcomes. That's what we will be discussing today. So, when we return, grab you a notepad and an ink pen or a pencil because you may find out something new. So stick with me. We all know the benefits of apple cider vinegar. Now, you guys know that I'm a vegan and that I have lupus along with other health issues. I used to take ACV every morning before I worked out, but eventually the taste of ACV got to me and I had to look for another alternative. And that's when a friend of mine turned me on to Goli. Goli is the first apple cider vinegar gummy. They give you all the benefits of ACV without the taste. That's right. Goli is vegan, gelatin-free, gluten-free, and 100% organic. And the vitamins and the ACV in Goli promotes a healthy heart by maintaining a healthy cholesterol range, controls blood sugar levels, and also curbs your appetite. And the best part about Goli, for every cell generated, a child in need receives a 6-month supply of essential vitamins with Vitamin Angels. So, if you don't believe what I'm saying, I'm going to give you some information so you can try Goli for yourself. Here's a promo code you can use. It's SUELYNN1. That's SUELYNNE1. And you'll receive 5% off of your initial purchase. Also, I'll leave a link in the description in the podcast. So, why don't you go and try it for yourself? You won't believe how good it tastes. That's Goli. Today's topic is about health disparities in lupus. And the objective is for you, I had to sneeze, to come away with knowing what health disparity is, for you to describe health disparities in lupus, such as health outcomes and healthcare delivery, and to sit and think about ways that you can try to help reduce health disparities in your own community. The definition of health disparity is as follows. Health disparities are the differences in the incidence, prevalence, mortality, and burden of disease, and other adverse health conditions that exist among specific population groups in the United States. Healthcare disparities refer to differences in access to or availability of facilities and services. Now, we all know that Black women are 3 times more likely to develop lupus than white women. Affects up to 1 in 250 Black women in the United States. Hispanic, Asian, and Native American populations are also more likely to develop lupus. Women are 9 times more likely to develop lupus than men. You know, one of the stark realities of health and healthcare in the United States is the disparity that exists between different segments of the population. This disparity covers a broad spectrum of conditions, but it's especially true when it comes to lupus. Lupus disproportionately affects females. It's more common and more severe in minority populations, and it tends to be more prevalent in people who are poor. Now, when the research states that, could it be an environmental issue where people with little to no means have to live? Or is it based on the education factor? Now, many factors contribute to health outcomes in lupus, including differences in the actual biology of the disease itself and the environment people live in. Okay, for example, the genes that predispose to lupus appear to be different in minority populations, and that may account, at least in part, for the difference in disease activity. Now, in addition to that, many of the drugs that are commonly used to treat lupus seem to work less well in people of color. However, there can be no doubt that factors associated with the healthcare system also contribute to health disparities. And what I'm talking about is poor access to care, lack of health insurance, delays in diagnosis, or poor quality of care are all problems faced not only by people with lupus, but at this point in time, with everyone. Now, taken together, all of these factors contribute to the healthcare disparities that are faced by people with lupus. They constitute a challenge for all of us and a real challenge for anyone who seeks to end health disparities in this disease. But there also exists another disparity that must be addressed. And we're going to do that. We will be addressing racial disparities in systemic lupus erythematosus treatment. So stay with me. Thank you for joining me. We are going to talk about another disparity that exists in treatment of systemic lupus. Yes, there is another disparity, and we're getting ready to address racial disparities in systemic lupus erythematosus treatment. That's right. And before I get started, I want you to think about the story I told you earlier about the doctor who said that I was smart and that I was educated based on the fact that I knew all the meds that I was on and what they were for. And, another thing he said to me that I did not mention earlier, he said, "You work out also, don't you?" Now, you remember everything I told you. And let's get into addressing racial disparities in systemic lupus erythematosus treatment. By conservative estimates, SLE affects approximately 161,000 people in the U.S., but we know it's 5 million worldwide. The disease is 8 to 10 times more likely to occur in women than in men, and 3 to 4 times more likely to affect African Americans than white Americans. In addition to the higher prevalence, racial disparities have also been observed in the disease course and outcomes of African Americans with SLE compared with white patients with SLE. Now, these disparities include significantly higher rates of mortality and depression, as well as greater disease activity and SLE-related damage accrual. Now, although the reasons for disparities have not been clarified, racial discrimination has been cited as a potential contributing factor. It can affect health through exposure, susceptibility, and responses to economic and social deprivation. Toxic or hazardous conditions, socially inflicted trauma, or inadequate health care. Now, previous research has demonstrated that higher levels of perceived racism and discrimination are associated with worse mental and physical health status, lower satisfaction with medical care, a greater likelihood of tobacco and alcohol use, higher levels of inflammation, increased risk for coronary artery obstruction, and a lower likelihood of seeking medical and preventive care. Now, I know people who have this illness who will not seek medical attention because there is a distrust for physicians. That's right. No matter how much I talk to them, there is a distrust with physicians. And one individual told me that, Susan, you know yourself, like I know, when we go to the hospital for a flare, a real bad flare, what is the first thing that they say to us? Are you looking for drugs? And I had to agree with that individual. Most doctors in the ER believe that patients with lupus, Black patients, are there to get the drugs to sell on the street, or that we are addicted to the oxycodones and whatever else they may prescribe for an individual who is in a flare. There was a high perception of healthcare discrimination in 56% of African American patients versus 32.8% of white patients. This difference remained unchanged after adjustment for factors that may affect perceptions of racism, such as socio-demographic characteristics and personal healthcare experience. Other factors associated with high levels of perceived racism were female gender and lower trust in physicians. Higher odds of greater disease damage, systemic lupus, international collaborating clinics damage index were found in African American patients compared with white patients, as were higher odds of moderate to severe depression as defined by a score of 17 on the Center for Epidemiologic Studies depression scale. Now, these disparities were no longer significant after adjustments were made for socio-demographic and clinical characteristics. Higher perceived racism among African American patients was linked to moderate to severe depression, even after adjusting for socio-demographic and clinical variables. Now, future research should explore the inverse relationship between trust in physicians and perceived racism to determine whether low levels of trust are a cause or a consequence of perceived racism, and whether interventions to enhance physician-patient trust can reduce perceived racism and lead to improved health outcomes. See, I believe that if it is taught in med school, the truth that you cannot lump all African American patients into this ball, a one size fits all ball, that we are all drug users. It needs to start in medical school. And it also, you have to look at too, if that physician comes from a racist background. I look at all of that. Stay with me and we'll continue. And we are back. You know, one of the best things that we could do, and I'm talking about those who have this chronic illness and others who suffer from chronic illness also, besides lupus. We have to start educating ourselves and speaking up. You know, I mentioned earlier about you are your own best advocate, and you are. That's why you have to educate yourself on your conditions. So when you walk into that doctor's office, you can believe that you're going to receive the same care Mary Beth received. You know, that's the way I look at it. Look, let me tell you. In plain words, regardless of whatever color you may be, there should not exist disparities when it comes down to treating the person for his or her condition. I, along with Jane, Bob, Joanne, and LaQuisha, have a right to receive top quality care regardless of our color. And there needs to be the preconceived notions that you see on TV about a different ethnic group. Get that out of your head. Why do you think that some individuals don't trust doctors? Think about that, people in the medical field. Think about that. But what is known about racial disparities in SLE outcomes? SLE is known to disproportionately affect non-white populations in the United States. SLE develops in African American women, for example, at rates that are 3 to 4 times higher than their white counterparts. Other racial and ethnic minorities, including Hispanic, Asian, and Native American individuals, are also at increased risk for SLE. Past studies have reported poor outcomes, including high rates of lupus, kidney disease, and other organ damage among African American, Hispanic, and Asian individuals with SLE. Furthermore, the risk for end-stage kidney disease from lupus appears to have risen dramatically from 1995 to 2004 in the United States, particularly among those between 20 and 39 years, women, and racial and ethnic minorities. In prior work with collaborators at Brigham and Women's Hospital in Boston, has shown that mortality and cardiovascular disease risks are increased among African American patients with SLE, but are surprisingly lower among Asian and Hispanic individuals with SLE compared with white individuals in the Medicaid population. Now, how can healthcare providers help to reduce these disparities? There needs to be an increased understanding of how race and ethnicity in SLE influence outcomes, may help them to identify patients at high risk for poor outcomes, improve prevention strategies, and enhance disease management among patients with SLE. Documenting and understanding this variation is important to determine prognosis for individual patients, and it may help further investigation into the root cause of such variations in mortality, including genetic, environmental factors. Given that decreased access to quality health care is a challenge for minority and disadvantaged groups in the United States, there needs to be assistance helping patients navigate a complex medical system may help improve outcomes related to the disease. Now, when it comes to the focus of research, future SLE research among racial and ethnic groups should consider the role of diversity in genetic factors, biomarkers, lifestyle and physical activity, other thrombotic risk factors, and socioeconomics among various subpopulations. Also, in my opinion, there should exist in rheumatologist's office, just like some doctors had back in the day, where if you were a diabetic patient, you would come into the office for a educational session to tell you about diabetes, how to use insulin, and what to eat. The same thing should exist in rheumatologist's office. Someone to sit down with patients and have an education forum to educate patients on what to expect with this illness. The proper dietary foods to eat, what to stay away from, staying physically fit, leading a healthy lifestyle. We no longer want, I no longer want patients who are being diagnosed with lupus to just get a pamphlet or a script and you're on your way to figure it out yourself. That day and time, doctors are over with. And more than likely, just like doctors were getting paid for diabetic education, maybe rheumatologists could be paid also for education to patients with lupus regarding this illness. It could be an hour-long class set on your slowest day throughout the week that could supplement your income, bring different individuals in. I no longer want to see patients just leave the office with a prescription and wonder, well, what else am I supposed to do? No, it shouldn't be like that. It really shouldn't. But yes, programs such as that should exist. It really should. Now, SLE is associated with alarming disparities in incidence, severities, and outcomes. The causes of these disparities are under study by several research groups. Identifying potentially correctable contributory factors should allow the development of effective strategies to improve the healthcare delivery and outcomes in all SLE patients. Like I said, doctors, think about it. That could possibly be another stream of income for you in 2021. Just think about it. Well, you know what time it is. It's time for me to go. Did you enjoy your Thanksgiving? I know you did. And you stayed safe also. But I want to leave you with this. Health is more than absence of disease. It is about economics, education, environment, empowerment, and community. The health and well-being of the people is critically dependent upon the health system that serves them. It must provide the best possible health with the least disparities and respond equally well to everyone. Joycelyn Elders. I'm Susan Hendricks, your host for My Story Living with Lupus podcast. I thank you so much for joining me for this episode. And to my Pandora listeners, thank you for joining me. I'll see you guys next week for another episode. Have a most peaceful, positive, and oh so safe and blessed weekend. I'll see you next week. If you would like to appear on an episode of My Story Living with Lupus, you can contact us at mystorylivingwithlupus@gmail.com. Also visit us on our Instagram page and also our website, My Story Living with Lupus. The views and opinions expressed on My Story Living with Lupus podcast represents each person's individual experience. By listening to this podcast or reading our blog, you agree not to use this podcast or blog as medical advice to treat any medical condition in either yourself or others. As always, consult your own physician for any medical issues that you may be having. My Story Living with Lupus podcast is officially trademarked, all rights reserved.